Welcome back. Today I am going to discuss with you all the ophthalmic vision of trigeminal nerve. In previous session, I have told you about the introduction of the trigeminal nerve. Means I have told you about its sensory root and its motor roots, about its fibers, about tracts, about nucleuses. And now today I am going to start with divisions of trigeminal nerve. So main divisions of trigeminal nerve are ophthalmic, maxillary and mandibular. These are the divisions of trigeminal nerve in which ophthalmic and maxillary are purely sensory nerves. So these are the purely sensory nerve, and mandibular nerve is mixed. Why it's mixed? I have told in previous section that mandibular contain the motor components and sensory components, which is the peripheral division of the peripheral process of the semilunar gland. So these two don't contain any motor components. So they are mainly sensory, especially ophthalmic. So today's topic of discussion will be the ophthalmic division. So this ophthalmic division is totally sensory. You can say pure sensory nerve and smallest from other three. So it leaves this is the semilunar ganglia. So it has three peripheral divisions. First ophthalmic, then middle maxillary, and then mandibular. And this is a central root. So this is ophthalmic division. This leaves the anterior-medial part of the ganglia and pass forward in the lateral wall of the cavernous sinus and enter the orbit through superior orbital fissure. So area supplied by these nerves are mainly scalp and this is scalp, skin of the forehead, upper eyelid, conjunctiva of eyeball, lacrimal gland, skin of the lateral angle of the eye, sclera of the eyeball, and lining of the ethmoidal cells. So, as I have told you that this ophthalmic division, this enter the orbit through the superior orbital fissure, it gives some branches along its course, and these branches, this is diagram of ophthalmic nerve which shows its branches. First of all, this is ophthalmic division, and this is maxillary, and this is mandibular. So ophthalmic division arises from the anterior medial part of the trigeminal ganglia or semilunar ganglia, which I have told you arise from the neurocrest. So this along its course, first of all, it gives a meningeal branch, that is the branch to dura mater, which is known as nervus tentori. So all these three divisions give one branches to dura mater. As I have told you earlier, that trigeminal nerve supply the extensive portion of dura. So branch given by ophthalmic division to the dura mater is the nervus tentori. Then it runs in the lateral wall of the cavernous sinus. Here it gives the communicating branches to cranial nerve 3rd, cranial nerve 4th, and cranial nerve 6th. That is oculomotor, trochlear, or occlusal nerve. Then it divides into three main branches: lacrimal, frontal, nasociliary. The lacrimal nerve or frontal nerve or nasociliary enter the orbit through the superior orbital fissure. These all enter the orbit, and lacrimal is the smallest and frontal is the direct continuation of the ophthalmic division and is the largest. So coming to the lacrimal when enter the orbit through the superior orbital fissure, it pours anterolateral to supply the sensitive fibers to the lacrimal gland. It also receives some fibers from the zygomatic nerve to supply the lacrimal gland, and these fibers are the postganglionic secretomotor fibers from the sphenopalatine ganglia. So its So lacrimal gland receives sensory supply from the lacrimal nerve, that is the branch of the ophthalmic region, but is also contain or also receive secretomotor fibers, which are the postganglionic secretomotor fibers from the sphenopalatine ganglia by means of the zygomatic nerve. So this zygomatic nerve carry the second order, that is postganglionic secretomotor fibers. It meets lacrimal nerve here, and then it gives its fibers to lacrimal nerve, and these fibers, secretomotor fibers, are supplied through the lacrimal nerve to the lacrimal gland. Now, frontal nerve, which is the largest or direct continuation of the ophthalmic region. It entered the orbit through the superior orbital fissure, and when it reaches the middle of the orbit, it divides into two branches, supraorbital and supratrochlear. Supraorbital larger, supratrochlear smaller. Supraorbital passes forward and leave the orbit through the supraorbital foramen, and or you can say supraorbital notch also. It supplies the skin of the upper eyelid, forehead, anterior scalp region to vertex of the skull. Supratrochlear is the smallest, and it passes toward the medial angle of the orbit, upper medial angle of the orbit, and passes the fascia of the upper eyelid and supplies the skin of the upper eyelid and lower medial portion of the forehead. So it remains till the forehead, but supraorbital is larger and go beyond the forehead to till the scalp, or you can say till the buttocks. Now, nasociliary nerve, that is the third main division of ophthalmic region. It entered the orbit same as the superior orbital fissure, and it also gives the branches during its course. First of all, 4 branches given in the orbit during its course, then branches given in the nasal cavity, and terminal branches given on the face. So, in the orbit, 4 main branches are given. First of all, branches are given long root of the ciliary ganglia. So, long root of the ciliary ganglia have the fibers of the nasociliary nerve. So, without synapsing in the ciliary ganglia, these fibers run by 2 or 3 short nerves known as the short ciliary nerves. So, no synapse occur. Second, long ciliary nerves. Long ciliary nerves which continue on the eyeball and supply the iris and cornea. These long ciliary nerves are 2 to 3 in number. These long ciliary nerves also receive postganglionic sympathetic fibers from superior cervical ganglia. So, long ciliary nerve receive the fibers from the superior cervical ganglia, which are the postganglionic, that is second order neurons. Now, posterior ethmoidal nerve, which run in the posterior ethmoidal canal and supply the posterior ethmoidal cells and sphenoid sinus. Then anterior ethmoidal nerve run along the medial wall of the orbits. Its filaments supply the anterior ethmoidal cells and frontal sinuses. And in the upper part of the nasal cavity, it divided into 2 branches. First and second one is external nasal branch. The external nasal branch, which at the junction of lower border of the nasal bone and upper border of the lateral cartilage, it also divide and supply. It supply the nasal tip, skin of the nasal tip and end of the nose. And the internal nasal branch gives 2 branches further, which is first of all septal branch, which supplies the mucosa of the septal area, and second one is lateral branch, which supply the superior and middle nasal fontanelle and anterior nasal wall. So this arises in the nasal cavity. So previously I have told you branches arising in the orbit from the nasociliary nerve. So nasociliary nerve also gives some branches in the nasal cavity to supply the mucous lining of the cavity. Then terminal branches of ophthalmic regions on the face. So ophthalmic region As first of all, ophthalmic region gives the nervous tentori branches. Then it gives communicating branches to other nerves like third, fourth, and sixth nerve. Then it gives main three branches like lacrimal, frontal, and nasocipy. Now it gives some terminal branches on the face. And terminal branches on the face are mostly intratrochlear nerve to supply the sensory fibers to the skin of the medial part of the bone, the eyelid, lacrimal sac, lacrimal cruncle. And these terminal fibers supply the skin on the side of the bridge of the nose. So this is all about the ophthalmic vision, which is the first vision of the trigeminal nerve, which is very important. So this is all about today's session. Thank you. Have a nice day.